Hi friends, after dealing with all the major gynecological problems, so basically as I told in our approach to gynecology video, we had one second, two super specialty branches in OBG. That is, one is infertility, especially in gynac. Second one is onco. These constitute almost 10 to 15% of the cases which you see in OPD, and in today's world it has been rising. So this is what we will discuss in today's class. So if you come to stats per se, majorly, okay, this is super specialty, so I am not touching everything here. Okay, they might have problems related to infertility. Okay, they might have problems related to recurrent pregnancy loss or any sexual health problems. Is what we see. Okay, for your level, for our level, even infertility per se is enough. So basically, if you see the classification, you can either have primary or secondary. Primary is never conceived. Here, conceived but unable to conceive now. So this is the basic definition which you should know. Classification. Now coming to definition, because you need, if you need to say a person as infertile, then you need to know the definition. So after 1 year of unprotected sex, if a couple is unable to conceive, and you say you do workup for infertility. Excuse me. Okay, so this is what basic things. Okay, now let me start this with a important quote or something. What do you want to say? I don't know. See, always in this especially in Indian scenario, women are blamed for infertility. But when a person comes to you with infertility, be it male or be it female, workup is for both. Okay, you cannot differentiate. Oh, I think it's female. Now that's why statistics is important. So even in every case of infertility, if you see any case of infertility, okay, 10% is unexplained. I'd say what is unexplained. Even after doing all tests, you are unable to find out the cause. That is unexplained. Okay, remaining 40, something to do with female. Okay, 50 done. Remaining 50% is something to do with male. So who are at higher risk? Male. So if it's a infertility, most likely it has something to do with male than female, is what I wanted to say. But in our society, females are the one who are blamed much. Okay, so again, if you see, we'll talk morely about female only, because OPG, even male will talk, but mostly female. Okay, so if you take up female related infertility cause, first, statistics. Okay, 45% of the cases are something to do with ovulatory disorders like PCOS, okay, or primary ovarian insufficiency, all those things. And this is something which is treatable, man. So that is why it's a good thing. Okay, then almost 35% of that, of the infertility in female, is due to tubal causes, a block or any pelvic inflammatory disease, TB or endometriosis, all those things. Then 7% of the things is due to uterine related abnormalities like septate uterus, didelphys uterus, or you might have Asherman syndrome, or you might have fibroids, which is not allowing the pregnancy to occur, all those things. Then 10%, which I told you, unexplained. Even after doing every test, you cannot localize the cause. Fine. Next 3%, 3 to 4% is something to do with autoimmune disease or any genetic conditions, all those things. So now you know the stats. Okay, based on this, you mostly think related to ovulatory and tubal. Okay, this is what the major two symptoms thing which you need to look into. but workup is for both. And you also see that in workup you will understand why we do all these things. Now I will come to that our anat physiopatho approach itself. See, so if you see as such, 1 second, yeah, coming to our anat physio and patho. Most likely primary infertility cases, you almost think of some anat related cause. Okay, most likely. So again, you have pituitary and hypothalamus, you have thyroid. Okay, major thing is reproductive organ, uterus, fallopian tube, ovary, cervix and vagina. Correct, no? So frankly speaking, now you can broadly classify as ovarian cause, which I told in statistics, tubal cause, uterine cause. Okay, then this is the major things in respect to anat. Okay, now related to physiology, I would like to talk. Same pituitary and thyroid. If any hypothyroid situation or any hypothalamic or hypopituitarism, and yeah, in case of Kalman, okay, all those things will lead to infertility. Okay, now related to our part 2, index of Robbins. So there you see that infection, especially chronic infections like TB, most likely she presents with that, and some genetic conditions like Turner's, Klinefelter's, they cannot produce offsprings, right? All those things. Then coming to all this radiation exposure, you will have reduced germ cells. So again, you cannot produce a kid. And all these benign conditions like fibroid and all, again they're least likely. And also endometrial cancers, all those things are least likely. Okay, but this approach is something which you should know, so that in broad you know, so that you won't get shocked when you see a patient of endometrial cancer not able to conceive. Doesn't occur in reality, but for sake of completion I am saying. Now you know what are the causes, now you know the statistics, now you know now need to know the workup. So you got the approach or way right, like how you need to approach a particular subject. For this in today's class we learned that there are two super specialty especially related to gynec. One is infertility and onco. Infertility constitute almost 10 to 15% of the cases which you get in OBGYN department. In that, most likely a patient presents with infertility. It can be primary or secondary, or they might have any recurrent pregnancy losses condition, or it might be a sexual disorder, sexual health problems related condition. For example, asking for advice, all those things. In the again, we taught when do you say it's a primary and when do you say it's a secondary, and also we discussed the definition, because we need to classify a person based on definition. Based on that, we talked about the statistics per se, because to know. And also important thing is, even when it comes to infertility workup, it's both male and female, and not only male or not only female. And also the 10% of unexplained cause which I taught about. Okay, then we discussed something related to statistics also, that 45% is something to do with ovulatory and 35 to something to do with tubal. And also we discussed about the same of anat physiopatho approach. And also one more thing, okay, let me touch up on investigations also here. Again, the same approach which you have biochemical, you can do an hormonal profile here, LH, FSH and all, especially if estrogen is less and FSH is high. What do you suspect? POI. Correct. This is enough. And if you are suspecting chronic infection and all, pathology comes, there you have to do CBNAT and all. But in other cases, all this Swyer syndrome and all, no, they come up later in life. So there you need to do a karyotyping and ultrasound pelvis also. If you need to count for any proper, follicles and all, that is also important. Then radiology per se, you do HSG also, histosalpingography, okay, to check for tubal patency. That is one more thing which we do. Micro nothing infections we taught, pathokaryotyping, biochemically all these hormones. That is the basic approach which you need to know. Then treat the pathology first. Okay, if it's TB, give ATT. genetic, you make sure you counsel them that they cannot have kids. Then treatment, yeah, I will discuss it broadly. Either you can first try, you know, via drugs. For example, you can use CC clomiphene citrate or letrozole, 2.5 mg BD for 5 days. You can try that. Or failing, you can use IUI, okay, or you can go for IVF. IVF again can be ZIFT or GIFT, that is zygote intrafallopian transfer or gamete intrafallopian transfer, or you can use your donor ducts or your own the donor X or your own X. Okay, that we'll discuss. Okay, here I am focusing morely on female. I will discuss even about male. Okay, this is morely to do with female related causes. Okay, otherwise, yeah, if she is this is the major thing. Okay, so this is the broader approach which you should know related to infertility. If you know this, we can discuss about the workup in our next class. Okay, that's it for today. Thank you.